and good evening. I'm Melisa Idris, and you're watching The Future is Female. This is the show where we find the extraordinary in every woman. Tonight in the show, I'm really delighted to introduce our guest, one Nadiah, one Muhammad Abdullah Yaakob. She is the group CEO of TMC Life Sciences and the CEO of Thomson Hospital, Kota Damansara. Welcome to the show, Nadiah. It's good to have you here joining us today. How are you?
I'm good, thanks. And thanks for inviting me.
Okay, that's good. So, one of the reasons why I wanted to have you on, and I've been following your work for some time now. I think I interviewed you for the first time about 3 years ago when you were with, if I'm not mistaken, was that your previous hospital? Was that Sunway?
Yeah,
That's right.
Sunway
So,
Medical Center. Yep.
Sunway Medical Center. And when you walked in, I was so pleasantly surprised to see this, young woman, the CEO, the hospital administrator, and, in charge of running this incredibly successful hospital. So I've been following your career since, and wanted to talk to you, especially in the past year. We've been dealing with the pandemic. Healthcare has really come to the forefront, and you've been quoted in many media, and I like I like the things that you're saying. So I thought, well, let's find out a little bit more about her journey. So that's why you're here today, and maybe you can start there. Tell us a little bit about how you started in the healthcare industry and why you chose healthcare administration in particular.
Okay, well, it's really quite simple, really. Biology was always my favorite subject in school, but my mother told me that I did not have that nurturing character required to be a doctor, and she is one of the few Asian moms to actually actively discourage me from going to medical school. So I ended up doing biochemistry at Harvard, and I worked in a virology lab actually for 4 years at Boston Children's Hospital. But at the end of it, I decided that a career in research was not for me. So I actually came back to Malaysia, and I worked as a strategy consultant with the Boston Consulting Group. And I vividly remember my boss telling me that I should probably go work in healthcare or education, because I think I'm really passionate about making the world a better place. I think that I've been blessed with a lot of privileges in my life, and I think it's my responsibility to sort of pass that on and do something to make the world we live in a better place. And healthcare and education are two of the big things that are really important for that. So I left BCG. I think my boss regretted telling me that, but I left BCG and I did a master's in public health in London, in the London School of Hygiene and Tropical Medicine. And then I came back to Malaysia, and I was actually hoping to join an NGO, and I actually applied to work at the Jeffrey Chia Foundation, but they thought that it would be a waste for me to be an administrator at the foundation, and they put me in the group strategy department and later seconded me to a healthcare division, and that's how I ended up being a healthcare administrator. And I think that when I first joined the hospital, and after the first year, it was very lucky timing, because they had a new CEO at the time, and when you bring in a new CEO, a lot of people resign, and so suddenly there were a lot of vacancies. So I took the challenge up, actually. So it was a lot of luck. I took the challenge to become the director of business development at the time at the hospital, the age of 27, and never looked back. I think that once I started working in the hospital, it was just so fascinating. The complexity that goes on, the very human nature of it, and I think I found my place.
So for those of us who may not be familiar with the intricacies of the healthcare industry, what exactly does a hospital administrator do?
I think it's like a combination of things. So a hospital is actually like a plant. There's a lot of like mechanical engineering things that happen, like oxygen, equipment, and even radioactive or nuclear stuff that's going on. So that's all really fascinating. And then there's the financial part of it, which is often what people focus on. And in healthcare, the people that pay for the care may not necessarily be the patient. You have insurance, you have employers, you have TPAs. So there's actually a lot of moving pieces, even in the financial and economics part of it. And last, and of course, the most important is the people aspect. So healthcare, at the end of the day, is a people business. It revolves around the doctors and the nurses and the allied health professionals that are giving care. Things are always changing in terms of new scientific discoveries. So it's a lot of moving pieces, and it's all really exciting. And every day there's always something new.
So how has your role, because you're talking about all these different moving pieces, and that's on I guess, an average pre-COVID day. How much more complex has the role become now that you're dealing with a global pandemic?
I think with COVID, really what happened is that it accelerated a lot of our plans to go digital. Of course, it seemed impossible for us to run a hospital with, half of the workforce not being in the office and having to conduct everything online. That was just anathema to a lot of people, but we managed to do that. And I think it was just really a laser-like focus on priorities, on what's important. And of course, the first thing was on patient and employee safety and health. I think that really came to the fore in terms of, do we have adequate testing and coverage, not just for our own employees, but the outsourced workers that are working in the hospital, because their safety is also affecting our safety. And then all the new SOPs and protocols that needed to be put in place, because frankly, an airborne virus is one of the biggest nightmares to manage, worse than, transmission through bodily fluids, because it's just so easy to contract. So I think that what has really changed is how we view our safety, our role in the community, the speed in which we expect to respond, because traditionally healthcare is really quite risk averse because, of course, people's lives are at stake. But in this case, we were kind of moving into a big unknown. There was a lot of calculated risks that need to be taken and decisions that need to be made and changed on a daily basis. So this is really a big change in mindset for a lot of people.
Can I ask you? I mean, that sounds really interesting, and I'm trying to balance, someone like you in a position where you're trying to run a hospital, and the science is what we know about the pathogen is evolving so quickly. You're trying to catch up with it. How do you make those decisions when you are balancing risk and patient safety? And I guess how many staff do you have working for you at the moment under Thomson Hospital, Kota Damansara?
So altogether in the group, we have more than 1,000 staff, and in the hospital alone, it's 980, if I'm not mistaken. Yeah, and that's excluding the doctors, who are about 120 doctors, 50 of whom are, or 60 of whom are resident in the hospital, meaning that they work there exclusively.
Right. So you've got 1,000 over people that you're thinking about, not to mention all the patients that walk through your doors. How do you balance that risk that you said, because healthcare is quite risk averse, plus the need to be very quick and agile to respond to the evolving disease? How did you do that in the past year? Did you look back and think, I did take some big risks and I'm happy that I did? Or, did you wish you moved a bit faster? Oh, any self-reflections in the past year?
Well, I think if we look back, it's really quite incredible where we've ended up. So we started off from a position where we were unsure about a lot of things. And so there was a lot of heavy discussions. There were a lot of meetings with the doctors, and understandably, and for me, I think I actually took a step back during this pandemic, because to be fair, I was not risking my life. And so when the doctors and the staff said that they were more comfortable with this or that, I would tend to defer to that, because really they were the ones who were putting their lives on the line. And so I think we had a lot of discussions, but primarily we all knew that this was our responsibility. This is why we chose to work in healthcare. And, this option of seeing COVID patients, whether we should treat them, that wasn't really the issue. The question is, how do we do it safely? How do we make sure that people remain protected and their families remain protected? So I think that when we kind of unite for a bigger purpose, I think that was something that really came true with the pandemic, because just suddenly everybody had to roll up their sleeves and join in together. And it wasn't an issue of, hospital management versus the insurance or the doctors. it was really something that really brought everyone together. But I think that I myself, I think I took a step back, and we established a task force to make all the clinical decisions. And I was just really trying to facilitate conversations between the different stakeholders, like the regulators and the doctors and the payers and the patients. But these people did risk their lives on the line on a daily basis. So I think their priorities or their opinions weighed more heavily.
That is fair. That is, I would have to agree with you. Can I ask you, Nadiah? I mean, you saying there's so many moving parts to this role. Which is the most challenging? Because you're juggling so many balls in the air. Are you particularly challenged by one area of the work?
Well, what I'm passionate about in healthcare is really changing the way in which it's being done in Malaysia right now. So in a private healthcare, currently it's a fee-for-service model where people go to the hospital, they pay the doctors, they pay the hospital for a specific treatment for an issue that they're facing. But really where healthcare is going is towards a more holistic, value-based care, where people shouldn't pay a lot for one episode, whereas paying a little bit more early upfront to actually prevent the disease from worsening would make more sense and would be more sustainable for everyone. So what we're actually trying to do, and paradoxically in healthcare, we collect a lot of data about people, x-rays, blood tests, and things like that, but we don't know them as an entire person. Like, I don't know this patient, how much time does he spend exercising? Is he a desk-bound person, or does he have a very physical job? Because actually all of these impacts the health. And so what we're trying to do here is to leverage technology to really understand patients better. And I think that that's something that hospitals and healthcare players could really do more, because other services that are highly regulated, like the financial services, have been doing this for a long time. To an extent that perhaps people find a bit scary, but I think that in healthcare, we have a lot to do to understand people better so that we can actually help them lead healthier lives and not just solve the problem that they're facing at the moment.
Is this a somewhat radical idea in healthcare, particularly in private healthcare? I know that you're the youngest hospital CEO. I think you were only, you're right now 36. I think you started out at 34, if I'm not mistaken. Is that correct, Nadiah?
I started off at 32. It's been 4 years.
Oh my goodness, there you go. Much younger than I expected. So, you bring to the table a lot of young and fresh ideas. Is this something that you say you're passionate about, making this change within private healthcare? Is this something that has been received well? Is this one of the more younger radical ideas that perhaps older, more experienced healthcare administrators might be more resistant to? What's been your experience?
Well, I think that a lot of times, of course, when people have a lot to lose, they tend to want to stick to the status quo. And I'm not saying that, the ideas that we have will always work out. But for me, it's not really a question about whether it's a success or failure, because I think it's just a continuous iterative process. Because if you don't try something out, nothing would change. If you do try something out and it doesn't quite work out the way you expect, you at least have learned something about why it didn't work. And so it's always been this constant way of implementing something new, test it out and see where it takes you and what do you learn and what do you take from that. I think one of the most difficult things, I think, is that when you implement something, and it may not work because perhaps the timing or the sort of like general environment wasn't right. It doesn't mean, it doesn't mean that the idea was wrong, but then having to bring that back to the table again, maybe like a few years from now, it becomes a more uphill challenge because people had a past experience where they felt that it didn't work. So for example, like telehealth is a very good example. It's not a new concept. It's been around for years. In fact, Malaysia had a telemedicine act that was dating back, I think, easily 15 years ago. But it's just that the timing wasn't correct. But now with the pandemic, we definitely see that people are so much more used to having services delivered to them on demand. And how is the healthcare industry going to adapt to this? And so now it becomes the right time. But then the question, I guess, always as a CEO is that the timing and the resources that you have at your disposal. So a lot of people, of course, are just looking at us and wondering, well, what's going to happen? Maybe let them try it out first and then see. But I think that what we want to pride ourselves in is that we try it out and we'll see how it works. And in fact, I think one of the first trainings that I had for my senior management team was actually in design thinking, which they had a bit of a culture shock about, because it's not something that healthcare administrators really focus on. They usually go for trainings on safety or quality or things like that. But for me, I think that with all the challenges that we're going through, the speed at which things are changing, it's really important that we look at our work as an iterative process and not just a pass-fail kind of thing.
All right. Nadiah, we're going to take a quick break, but let's come back and continue this conversation, because I understand that you've just been appointed as director of the Institute of Corporate Directors Malaysia. So let's come back and talk a little bit about that role. Stay tuned to The Future's Female. We'll be right back. Welcome back to The Future's Female. I'm Melisa Idris, and I'm chatting today to Nadiah, who is the CEO of Thomson Hospital, Kota Damansara. And as I mentioned just before the break, Nadiah, congratulations. You've just been appointed as director for the Institute of Corporate Directors Malaysia, which is really important because, board of directors often set the tone for the rest of the organization. And you're championing diversity in board directorships. Tell me why that's so important to you.
So when ICDM recently released their survey about board directorships, actually Malaysia or Malaysian boards are actually pretty diverse when it comes to gender diversity. We're not too bad. And I think that this is also credit to SC, the Securities Commission, and Bursa Malaysia as well, who have actually been actively campaigning about it, looking at the 30% club and things like that. But I noticed that there was a very big red flag that was there in the sense that there was also an issue with diversity from other factors. Most particularly, it was age. The average age of a corporate director in Malaysia is actually 60 years old.
Oh, wow.
And to me, that was a bit troubling because there are a lot of young entrepreneurs right now who are developing startups, who are leading companies, and who will need actually directors who understand, where this business is going. When we talk about digital transformation, we talk about the power of social media. And yet it seemed like the generation of corporate directors was just very confined to a certain age group, which I think would be a mistake. That for boards, they should consider people who have different viewpoints, because it's very stark, I think, the difference between the generations, the intuitiveness in which we view technology and the gadgets in which we grew up with. So I think it's really important there. And it could be a matter of just identifying them, that perhaps younger people, I find, don't have that network of acquaintances, people that they know, that would bring them to the attention of people who are seeking new board members. And so this is something that I think I would like to take on, so that I can sort of use the greater network that I have, my peers, who are really passionate about many different things, of healthcare, about sustainability, about climate change. These are things that I think people in my generation are really social justice. These are things that really get us fired up, and we want to see change. And I think that putting more of these representatives on the board would actually make these companies a lot more prepared to face all these changes that are going to happen in society.
Nadiah, how does one go about having that conversation with the board of directors? Because, okay, I can understand making the argument for increasing gender diversity, making boards more equally represented. There's been a lot of push in that direction, a lot of social awareness, but it's not the same when it comes to age diversity, right? Particularly as stewards of an organization, board of directors, you have an image of what someone sitting on a board of director looks like or represents, years of experience in the corporate sector, something that can provide some direction to the company. How would you make the argument to fill one of those seats with a young person who may not have the requisite experience as everyone else at the table, but brings a certain perspective that could be invaluable to the direction of a company?
Yeah, so I think that's why it's important that organizations like ICDM are there to really educate boards and shareholders really about the importance of having diversity of viewpoints in a board. And often those diversity, it comes by, say, having like maybe we have someone with a legal background, someone with an accounting background, things like that. But really, when we look at the big issues that really affect companies and the society we live in, like racial justice and climate change and all that, what we find is that people in the younger generation, because they're passionate about it, they are the ones who are garnering expertise in these areas. So people who have done PhDs in sustainability and climate change, people who are looking at AI, technology, cryptocurrency, blockchain, they tend to be of the younger generation because these things were new when they were starting to venture out. And so they latched on these areas to sort of build their expertise on. So it's a matter really of like asking the boards, like what do you think will be the biggest challenge to your business, and looking at a much wider sort of like a field of candidates. And it's a two-way learning process too. I mean, for us, I think in the younger people, when we sit on the board and we look at, okay, so all these are all the legal requirements, we understand why things need to be done a certain way. But we also give a different perspective to the boards on how to do things differently. So one funny anecdote that I had was, so the other new member on ICDM is actually Joel Nyo, who is the founder of FAVE.
Yes.
And our first board meeting, so Joel was actually using a walking desk. So he was standing up throughout the entire meeting. And all the directors were like, oh, do you stand up for all your meetings? And he was like, yes, because I find like with this lockdown, I'm not getting enough exercise. And so like, it just brought a very different perspective to like how people are actually changing and adapting to life. And it just gives them something new to think about. And I think that they're excited about that. So oftentimes I think that this is something that would help really convince them to see the benefits of why you should have a more diverse age group within the board.
Well, I mean, diversity can only bring more ideas and more inclusivity. And I'm glad that you're championing this. But Nadiah, you also you wear multiple hats. And one of the hats I wanted to talk to you about was the fact that you are currently the vice president of the Harvard Club of Malaysia and an interviewer for Harvard College admissions. So in that role, we've heard news that 2 Malaysians made it into Harvard for, Muhammad Akil Azmi and Zachin, who beat, 40,000 other applicants.
So they were admitted last year. This year's admits is Hamdi Hakimi and Gerald Cheong.
This is quite amazing because we've got, it was quite a long time ago, 2017, when the last Harvard Malaysian was admitted into Harvard, and now we have these 2 young Malaysians, and this year we've got new admissions as well. What are you seeing in terms of a trend? Are we seeing more Malaysians getting accepted into Harvard? Is this something that we should be very proud of and hopefully see more of in the future?
So there are actually not that many Harvard undergraduates in Malaysia compared to all the other Harvard schools, like Harvard Business School or the Kennedy School of Government. So we were actually very, very excited. The 2 of us, myself and Nicholas Kaw, who's the other interviewer for Harvard College, we have been interviewing ever since we graduated. because the Harvard views the interviews as a very important part, I think, of admissions, because they want to
What does an
see.
interviewer do? So
Yeah,
because you graduated from Harvard, you interview local applicants who are
correct.
going in? Okay.
So what happens is that Harvard receives all the applications from Malaysia, and they will actually shortlist them. And then they will assign us the candidates to be interviewed. So this year, actually, we only interviewed 3 candidates, and 2 of them were accepted. So we were very excited. And it's a very informal interview. So we just reach out to the candidate and organize a session. And really, the whole point of the interview is to get to know the person beyond the papers that they submitted. What do they do? What are they passionate about? What do they want to pursue? What kind of person are they? Would they be a good roommate? Are they intellectually curious? What books do they read? But primarily, I think the number one question that I would ask anyone is really to think about, in terms of achievements, what would not exist in the world today if it wasn't for you? Because I think in Malaysia, we have this tendency, we have a lot of good students. They're smart, they sit for their exams, they get a lot of straight A's, but a lot of times their activities are sort of arranged for them, like co-curricular activities, or they go for certain classes or competitions. But really, we want to see something like one step further, right? So are you a catalyst for something to happen? Did you do something with what you have? And it could be, something very small based on the resources that you have, but it really shows the initiative and the willingness to lead to do something.
Nadiah, thank you so much for speaking to me today. It's been such a pleasure, and I've learned so much from you, and so inspiring to see how much you are taking on to try and make the world a little bit better through your healthcare role, and through through the directorships, through the board of directors, and then through helping Malaysians get through that final process to go to Harvard. Thank you so much for joining me on the show today. Appreciate your time.
Thank you.
Thank you. All right, that's all we have for you on this episode of The Future is Female. I will be back with you same time next week. Thank you so much for watching. Good night, folks.